Hello everyone, in this video we will talk about drug of choice for autonomic nervous system pharmacology. So before starting the video, if you are new to our channel, please subscribe our channel so that you will become our pharmacology made easy army. So first is mushroom poisoning. If mushroom poisoning is early caused by inocybe, then the drug of choice for this condition is atropine, while for delayed poisoning the drug of choice is thioctic acid. For glaucoma, in case of open angle glaucoma, the drug of choice is latanoprost. What is latanoprost? We should talk about latanoprost. But before talking about latanoprost, what is atropine? Atropine is non-selective muscarinic blocker. It is also called cholinesterase blocker or anti-muscarinic drug. Okay, the atropine is used in case of antidote for mushroom poisoning. But what is atropine? So atropine is non-selective muscarinic antagonist. And what are the effects of muscarinic blocking drugs on different organs? For example, on CNS, this drug causes sedation, anti-motion sickness action, anti-Parkinson action, amnesia, delirium, while on eye they causes cycloplegia, mydriasis. On bronchi they causes bronchodilation, okay, especially if bronchi were already constricted. The action on eye and bronchi are due to block of M3 receptors. M3 receptors which are present on both bronchi and eye. Also M3 receptors are present on GIT and genitourinary tract, and some M1 receptors are also found in GIT. So in GIT they causes relaxation of smooth muscle, slowed peristalsis, and they cause reduced secretion, specifically reduced salivation. In case of genitourinary tract, the antimuscarinic drugs causes relaxation of bladder so that on relaxation of detrusor muscle there is urinary retention, and this action is also due to blockage of M1 and M3 receptors. On heart there are M2 receptors, so in case of heart they causes initial bradycardia, okay, especially at low doses. Then there comes the tachycardia, okay, tachycardia. The tachycardia, this is due to post-synaptic muscarinic receptor blocker in case of sinus and AV node. Okay. Next come blood vessels. In case of blood vessels, they cause blockage of muscarinic vasodilation. This is not manifested unless until there is muscarinic agonist is present because these receptors are not innervated. In case of glands, they causes reduction of secretion. For example, they cause reduction of saliva, lacrimation, sweating, but comparatively less reduction of gastric secretion. And the receptors for these are M1 and M3. Okay, while on skeletal muscle they have no any action. This was all about atropine. While for delayed mushroom poisoning, the drug uses thioctic acid, but thioctic acid has no important information as compared to atropine. Next come latanoprost. Latanoprost, what is this latanoprost? Latanoprost is prostaglandin F2 alpha analog. Okay. Then come astazolamide. What is astazolamide and what is its use? Astazolamide causes decreased secretion of aqueous humor because it blocks the carbonic anhydrase enzyme, and this carbonic anhydrase enzyme is not only present in eye aqueous humor secretion but also present in the kidney. So the astazolamide is basically a diuretic. Okay, astazolamide is diuretic. The other drugs which are carbonic anhydrase inhibitor are dorzolamide. Let me show you dorzolamide and the brinzolamide. They are used for mountain sickness, okay, acute mountain or high altitude sickness, while they are topical use in the treatment of closed angle glaucoma. Okay, next come myasthenia gravis. For myasthenia gravis the diagnosis is done by the adrophonium. What is adrophonium? The adrophonium is basically a choline esterase inhibitor. Okay, this alcohol, while other cholinesterase inhibitor include carbamates and the organophosphates. The prototype of organophosphate is parathione, which is important insecticide, while neostigmine is prototype of carbamates. Okay, carbamates. The adrophonium is used in the diagnosis of myasthenia gravis and also used in differentiation of myasthenia crisis from cholinergic crisis. How? Because both of these conditions result in weakening of skeletal muscle. So after the administration of short-acting adrophonium, we will see the muscle strength. If muscle strength improve, if muscle strength improve, then it would be a myasthenic crisis. But if muscle strength doesn't increase or doesn't improve, then it would be cholinergic crisis. Okay, for the diagnosis of myasthenia gravis and the differentiation of myasthenia gravis from the cholinergic crisis, the drug uses adrophonium, while the treatment of myasthenia gravis, the drug uses neostigmine and the pyridostigmine, and also include the physostigmine and benonium, which are carbamates. Next come belladonna poisoning, Atropica belladonna poisoning. For the Atropica belladonna poisoning, the these drugs are used as antidotes. Okay, the drug used for belladonna poisoning is the physostigmine, which is actually a atropine poisoning. So the physostigmine is used as antidote for atropine poisoning. Okay, atropine poisoning. While the poisoning of organophosphate is treated by atropine, but this drug has no action on nicotinic because atropine only blocks muscarinic receptor. So nicotinic toxicity is treated by respiratory support. Okay. Next come Dhatura poisoning. Dhatura is a plant, again poisonous plant just like atropine, and once again the drug is physostigmine. Okay. Next is Alzheimer dementia. The drug uses rivastigmine, which is again a carbamate, okay, which is used in the Alzheimer disease. Okay, Alzheimer disease. The cobra bite. The drugs are actually anti-venom. Next is anticholinesterase poisoning. For organophosphate poisoning or carbamate poisoning, the antidote is atropine. For colicky pain, the drugs used is anticholinergic like hyoscine and dicyclomine. Okay, colicky pain. These are anticholinergic drugs, hyoscine and dicyclomine. Next come the bronchial asthma. For bronchial asthma, the drug used is salbutamol, which is also called albuterol. For refraction testing, okay, in adult, the drug uses tropicamide, while in children, the drug uses atropine. The atropine and tropicamide both are actually the anti-muscarinic drugs. Okay, both are anti-muscarinic drugs, tropicamide and atropine. While darifenacin, physotolidine, solifenacin, darifenacin, piranzapine, tiranzapine, they are antimuscarinic. For M3, they are darifenacin, physotolidine, tolterodine, and solifenacin. For M1, there are piranzapine and tiranzapine. Okay. For anti-nicotinic ganglionic blocker, there are hexamethonium, trimethophan, and macamylamine. For fundoscopy, observation of fundus of uterus, the drug uses phenylephrine. What is phenylephrine? Phenylephrine is sympathomimetic, which is alpha 1 selective. Alpha 1 selective. Next is uveitis. Uveitis meaning inflammation of uveal tract. Uveal tract include choroid, also include ciliary body and iris. For iridocyclitis, the drugs used are atropine, while posterior uveitis and panuveitis, the drugs used are steroids, anti-inflammatory. For bradycardia, the drug used is atropine because atropine is muscarinic blocker, so it causes tachycardia, but it initially causes bradycardia. For AV block, also used are atropine. While the drug induced Parkinsonism, this is treated by anticholinergic like benzhexol. For shock, there are numerous drugs like cardiogenic shock is treated by norepinephrine or dopamine, while with oliguria, the drug uses dopamine because dopamine stimulates D1 receptors. For anaphylactic shock, the drug uses adrenaline. For distributive shock, the drug uses noradrenaline or phenylephrine. While for septic shock, there are antimicrobial drugs, just like fluoroquinolones. While shock due to adrenal insufficiency is treated by corticosteroids, while hypovolemic shock is treated by saline ORS solution, while secondary shock is treated by pyrazosine, which is alpha blocker. The postural hypotension, which is caused by alpha 1 blockers like pyrazosine, trazosine, is treated by fludrocortisone. Attention deficit hyperkinetic disorder or hyperreactivity disorder are treated by methylphenidate, while narcolepsy is treated by modafinil and armodafinil. The pheochromocytoma before surgery and long term. Before surgery, the drug uses phenoxybenzamine. The phenoxybenzamine is irreversible, non-selective alpha blocker, while reversible include phentolamine. The rebound hypertension due to clonidine withdrawal is treated by phentolamine or tolazoline. Raynaud phenomena is treated by calcium channel blocker like nifedipine, okay, or amlodipine. The essential tremor is treated by propanolol. Propanolol is non-selective beta blocker, while the alpha 1 blocker include pyrazosine and alpha 2 include euhembine. For akathisia, the drug uses propanolol, and propanolol is also used for cardiomyopathy. For the antidote of beta blocker poisoning, the drug uses glucagon, while for benign prostatic hyperplasia, if presenting with hypertension, is treated by pyrazosine or doxazosine. If without hypertension, we use tamsulosin. Last drug of this is performance anxiety, and the performance anxiety is also treated by propranolol, which is non-selective beta blocker. This was all about the drug of choice for autonomic nervous system pharmacology. Hope you have liked this video. Please subscribe our channel. Stay tuned.